One of the most rewarding experiences of being a doctor is seeing something that I do ends up being life changing for the patient. Believe it or not, successful treatment of stubborn acne belongs in this category. Every time I see a teenager being bullied at school because of horrible acne, my heart literally aches. When their self confidence is being eroded by constant malicious remarks, the stares, the smirks, and the sense that you just don't belong, all of it is very disheartening. Now, I've been seeing dermatologists and primary care providers do wonders for many patients with horrible acne. But how about those who are not able to benefit from conventional medicine, or for one reason or another, unable to tolerate the usual medications or therapies prescribed, due to side effects, for example? The great thing is that my expertise in Chinese medicine gives the patient additional options to choose from. When looking at acne, conventional medicine and Chinese medicine address all the same causes, from infectious etiologies all the way to hormonal imbalances. I have found that their approaches actually complement each other quite well. I get consulted very often with patients who have already tried numerous therapies, topical and oral antibiotics, multiple skin cleansers, spironolactone, birth control pills, and even retinoids like topical tretinoid and oral Accutane. All of these individuals feel like they have been cornered and arrived at a dead end. This is where Chinese medicine has produced amazing results. In my private practice, I first review all their current medications and skin hygiene routines. If they're a female, I evaluate whether or not they have problems with being overweight or if they have irregular menstrual cycles. I check to see if they already have signs of depression or other mood disorders. And this could be depression long before their acne worsened or depression because of the acne itself. Societal pressures on outward appearance and beauty affect the body in many physiological ways. Unfortunately, more often harmful rather than beneficial. Continuing the evaluation, I also check their diet, especially what they crave on a daily or near daily basis. I assess whether or not they are on any unnecessary supplements or over the counter acne treatments which are causing more harm than good. So the goal first is to simplify, simplify, simplify. Get all the extraneous things out of the way and stop anything that has proved to be not likely effective or no longer effective at this point. I follow up with confirming with the patient that they are using the correct daily skin hygiene routine, whether it is just plain gentle soap and water or with the addition of topical benzoyl peroxide. Next, most patients start fresh by going through a detoxification regimen using Chinese herbs. Now, not all patients need this, but there are clear indicators during a Chinese medicine consultation to justify whether this is necessary or not. For example, a quote-unquote floating pulse detected would be one of those indicators. Now, for some patients, the detox regimen itself already helps revitalize some of the previous conventional medicine treatments that stopped working. At this point, I can restart the topical antibiotics or even the topical tretinoid. Some patients start to see improvement in their acne already by this stage. Now, there is also a substantial group of patients that need more than just a detox regimen. This group, depending on their individual characteristics from a Chinese medicine standpoint, will start a fortifying regimen of herbs that help regulate the production of sebum. This is the waxy material on the skin. These herbs also regulate skin cell turnover and also improve the skin's defenses against infection. One key benefit is that the fortifying herbs have an anti-inflammatory effect. As the acne starts to calm down, the skin is given a breather, so to speak. Many times, the skin not being able to take a breather is the biggest barrier for patients whose conventional medical therapies stopped working. The inflammation from the acne prevents the skin from rebuilding properly, and the cell turnover is so abnormal that any new skin on the surface is super vulnerable to producing more acne. Understand that acne creates skin with abnormal structure, and this in turn creates more acne. In order for the patient to get better, this vicious cycle must stop. And I have found that Chinese medicine offers exactly one of these opportunities. With the fortifying herbs, I have found that we no longer need to use spironolactone for its anti-androgenic effects. The most satisfying part of using Chinese medicine as an adjunctive acne treatment is the subsequent high likelihood of being able to avoid oral antibiotics and oral retinoids, both of which have considerable side effects. Once the active acne eruptions are controlled with satisfaction, I then recommend having a cosmetic dermatologist perform the treatment of scar removal.